right, so when doing patient assessments in EMS, we use an acronym called sample history. Signs and symptoms, allergies, medications, past history, last oral intake, and events leading up to whatever you call EMS for. Signs and symptoms. What do you see with the patient? Are they vomiting? Does it look like they breathing well? Are they tripoding, like they having difficulty? What do you see? What can you observe? Or what they can tell you? So your next one is allergies. Allergies to medications, allergies to any food. If they had an allergic reaction, you want to see if anything made them break out. So you want to know this. Now I want you to keep in mind that while we're doing this, we're not trying to diagnose the patient. What we're doing is just gathering information so that we can make an informed decision on the proper care. Now you go to meds. Sometimes the patient might not even be responsive. They might be unconscious, they might not be alert, and you can look around the room at medication bottles for one, their name, birthday, you get information, and you also get a diagnosis of what they might be dealing with when it goes to past medical history. So you can ask them things like, all right, have you had a heart attack in the past? Are you a diabetic? Last oral intake. What was the last thing that this patient ate? What was the last thing that they drank? Events. What were you doing prior to calling EMS? Were you running? Were you sitting down? Were you laying in bed? And with all this information, vital signs, everything that you gathered, now you can make an informed decision on the proper care for your patient.